Hello everybody and welcome to my teaching channel. I'm Dr. Sadiq and today we'll be learning about what is an ECG. So the ECG or electrocardiogram is a cardiac diagnostic tool that is used to assess electrical conduction within the heart. It was first invented many years ago by Dr. Willem Einthoven, who found out that by soaking his limbs in salt solution, he can record the electrical activity of the heart and display it in graphical format. Since then, the ECG has become a very simple tool that can be obtained from a patient within a few minutes. Electrodes are placed on the chest and on the limbs, and within a few minutes you have a 12-lead ECG tracing that can be used to diagnose multiple abnormalities of the heart. So how do we read an ECG? Well, it's first important to understand what an ECG is comprised of. When you look at a normal ECG, you will find multiple complexes. These complexes are repetitive, and each one of those complexes represents the cardiac cycle. We call those PQRST complexes, and we'll get into what that means in a minute. A 12-lead ECG is also made of 12 different leads. You can think of these leads as different ways of looking at the heart, or 12 angles of looking at the heart. Leads 1, 2, 3, AVR, AVL, and AVF are limb leads which look at the heart in the longitudinal direction, and leads V1 to V6 are precordial leads which look at the heart in the horizontal direction. Before understanding what each of the components of the ECG refer to, let's look at the cardiac cycle. During every cardiac cycle, deoxygenated blood returns from the venous circulation into the right atrium. The right atrium then contracts and empties the blood through the tricuspid valve into the right ventricle. The right ventricle then contracts, pushes out the blood into the pulmonary circulation where the blood is oxygenated again. It then returns to the left atrium through the pulmonary veins. The left atrium then contracts, pushing the blood through the mitral valve into the left ventricle, and the left ventricle will contract, pushing the blood through the aortic valve to the rest of the body, where blood will deliver nutrients and oxygen. That comprises one cardiac cycle. So for each cycle, the atriums will contract, pushing the blood into the ventricles, and then the ventricles will contract, pushing the blood to the rest of the body into the lungs. This process happens 60 to 80 times per minute on average for your whole life. And if it stops, life will cease. The mechanical contraction of each of these 4 chambers of the heart is driven by the electrical conduction system of the heart. So the electrical signals will travel through the myocardium or heart muscle, which leads to mechanical contraction. If we examine the electrical system of the heart, we find that the pulse originates in the sinus node in the right atrium, also called the SA node. This is the pacemaker of the heart and determines the heart rate. The impulse originates in the sinus node and travels through the right atrium, followed by the left atrium. This is represented by what we call a P wave on the ECG. This is the first positive deflection that is low in amplitude. This P wave is followed by contraction of both the right atrium and the left atrium, emptying their contents into the right ventricle and left ventricle. The electrical signal then travels to the AV node. Here, there is a delay. This AV delay is shown as the PR interval on the ECG. It is the space between the P wave and what follows. This delay is important for multiple reasons. One of these reasons is it allows the atriums to contract and fill the ventricles prior to the ventricles contracting. Another reason is this delay slows down any abnormal, fast electrical impulses from the atrium. For example, a patient who has an atrial arrhythmia, there will be a delay in the impulses getting to the ventricle, and so the heart rate will not be high to the point where the patient may pass away or die. Following this delay, the electrical impulse travels and depolarizes specialized electrical cells called the His-Purkinje system. The His-Purkinje system will then lead to the bundle branches, the left bundle and the right bundle branches. These bundle branches will propagate electrical signals throughout the His-Purkinje system of the ventricles, and then the electrical signal will be received by the myocardium or the muscle of the left ventricles. This depolarization of the ventricular myocardium is represented on the ECG as the QRS complex and is followed by contraction of the right ventricles and right ventricles together. Following this, there is a period where the electrical signals in the heart reset back to the baseline. This is called repolarization. This repolarization is represented by the T wave on the ECG. Now the cardiac cycle has reset and will restart again with another impulse from the sinus node. It is important to note that the electrical signals travels in the right atrium followed by the left atrium. So the right atrium and left atrium depolarize sequentially. So the first part of the P wave is the right atrium and the second part of the P wave is the left atrium. However, the ventricles, the right ventricle and left ventricle, depolarize simultaneously because signal travels through the His-Purkinje system normally simultaneously to both ventricles. When we look at the electrical signals traveling through the heart, if the depolarization proceeds towards the electrode we are examining, there will be a positive deflection on the ECG. If the depolarization is proceeding away from the electrode we are examining, there will be a negative deflection on the ECG. Hence, by placing electrodes in different angles around the heart, we can assess the direction that the electrical currents are traveling. To do so, a standard ECG involves placement of an electrode on the right arm, right leg, and left leg. Electrodes are also placed on the chest from V1 to V6, and this graphic here shows exactly where the electrodes need to be placed. What we call the limb leads are leads 1, 2, 3, AVR, AVF, and AVL. Lead 1 is the vector from the right arm to the left arm electrodes. Lead 2 is the vector from the right arm to the left leg, and lead 3 is the vector from the left arm to the left leg. The right leg electrode is used as a grounding electrode. These limb leads electrodes give us the vectors 1, 2, and 3, which represent an angle of 0 degrees, 60 degrees, and 120 degrees. We can get more information by deriving other vectors. These are called AVR, AVL, and AVF. AVR is lead 1 plus lead 2 divided by 2. AVL is lead 1 minus lead 3 divided by 2. And AVF is lead 2 plus lead 3 divided by 2. AVR will give us 150 degrees, AVL will give us minus 30 degrees, and AVF will give us 90 degrees. Hence, we now have an almost 360 degree longitudinal image of how the electrical signal travels inside the heart. The precordial leads offer us a more horizontal view of how the electrical signals travels through the heart. V1 is placed on the right side of the sternum and overlies the right ventricle. V2, V3, and V4 are placed over the left side of the sternum on top of where the septum of the heart would be, between the right ventricle and the left ventricle, and V5 and V6 are mainly over the left ventricle, which give us an idea of electrical conduction through the wall of the left ventricle. Thus now, with a combination of the limb leads and the precordial leads, we have almost a 360 view of the electrical conduction of the heart, which gives rise to what we know as the 12-lead ECG. Now that you know what the ECG is, we'll get to specific interpretation of the ECG. If you like this channel, please subscribe to keep an eye out for more teaching videos. Thank you.